Let's hear from those who've chaired the National Forum over its first 20 years. Note how they talk about both what has been consistent and what has evolved and adapted over the years.
Most from the beginning of this process, which was in the gestation period of the National Forum, was the terrific energy in developing the Public Health Action Plan to prevent heart disease and stroke. More than 110 participants in the process, and a tremendous product that was waiting to be implemented and delivered.
John, it's the people. I had the privilege to meet, work alongside, and establish lifelong relationships and friendships with so many great individuals. I'd add to that list Dr. Darwin Labarth, the architect of our National Action Plan to prevent heart disease and stroke, and the inaugural director of the CDC's Division of Heart Disease and Stroke.
I recall my excitement to really, for the first time, to have all the non-governmental organizations, the private sector, local, state, and federal public health agencies, clinical and academics together at the same table. I got to talk to many of them one-on-one, never before as a group.
One of the highlights that I had as a leader of the National Forum was to have a board member meeting here in New Orleans, my home. And we had a personal tour that I led that didn't just go to the areas where you would think the French Quarter, but we went into the neighborhoods, including my ancestral home, the Lower Ninth Ward, which had been so heavily damaged by Katrina. And it energized and further committed our dedication to health equity.
I saw enormous growth over the well over 8 years I was involved with the National Forum, growth that included ongoing addition of multiple members to the forum that really helped diversify our work together. And that included governmental liaisons from really across government, public health leaders, scientists. And I will say one real highlight was our engagement of mayors, and moving with mayors was a really critical part, I think, of engagement at the community level.
Our collaboration with Dr. Steve Sidney, we packaged his really important work on the burden of cardiovascular disease into an annual signature report that tracks where our nation stands in confronting this immense challenge, really seeing if all these efforts are moving the needle.
Well, one thing I remember very clearly is that the year before I took over, our board chair at the time asked, how do we know that our programs are having any impact? And she was referring specifically to Move with the Mayor. And that was a great question that perhaps we hadn't asked. So what I really focused on during my tenure was ensuring that all of our programming, not only did we measure progress against our programs, but also ensured we were measuring impact. And I think that really signaled a change in how we looked at our programming moving forward.
We really solidified our commitment around Move with the Mayor. It had been an initiative that was growing within the organization, but with the board, we put strong KPIs in place and really worked strong with mayors to grow our strategy with Move with the Mayor.
My leadership year was actually a 2-year period, and it happened to run with COVID. The thing I remember most is the flexibility of the organization of the National Forum and its members to remain relevant in terms of what's important to the people we serve and our members, and to be a voice on the national level for improving outcomes with heart disease and stroke.